routinely, people walk out of a session feeling very relaxed, profoundly relaxed. That's the first upfront kind of experience that craniosacral therapy offers, is this profound, deep psychophysiological relaxation, which oftentimes, more often than not, is a new experience for somebody. We tend to think of relaxation as, come home and turn the TV on or something, and that,
right.
we're not actually relaxing.
So there's a difference here between a mental relaxation versus an all-over, complete and physical relaxation.
That's right. You can measure relaxation using EEG, electroencephalography, or measuring heart rate or cortisol levels, and they go down significantly with something like craniosacral therapy. And it's more often, as I said than not, it's a unique experience and an unprecedented experience, because we don't have opportunities in our culture for deep, deep psychophysiological relaxation.
Yeah, because it's on so many levels, right? And it's such an inner experience.
Exactly.
Yeah, it's not because of a substance, a drug, a sleeping pill, a beer, whatever.
Right.
It's really in oneself.
Right. And if somebody has done yoga or other very gentle forms of body work that involve breath and attention and the training of attention, it's a similar kind of experience. Somebody once said having a craniosacral session is like having 10 yoga sessions in one. It's really deep. So that's
I believe that I can relate.
Yeah, that was your experience when
yeah, and it's amazing, because the more we give ourselves the opportunities to experience that, the more likely we can go back to it.
Exactly.
It's like retraining ourselves.
Exactly. And that is something that ideally happens in infancy, between the mother-child bond, is that there's this, the mother is able to convey through her own changing of her consciousness at will to relax herself, to be able to go into that deep state of relaxation, that the child kind of subconsciously learns through a somatic experience. That's how you do it. This is the nature. This is what all the theorists of attachment parenting talk about, is that it's the mother's capacity to be able to induce that in herself that then induces it as a resonance in the baby.
So it's more than role modeling, it's a felt thing.
Oh yeah, it's completely somatic. It's a completely somatic. It's an experiential thing. You can't just pretend to do it. As a mother also, you can't do that. You can't fake it. You cannot help a child to relax if you're not doing it yourself. Which is why, and I, maybe now I can just talk about this.
Yeah, sure.
That a baby coming in to see me, when someone comes in for a first session with an infant and maybe a young baby up to about 2 years old, I routinely will ask that I work with the mother first, and for a whole variety of reasons, and the most important of which is that it really is the mother's experience and her capacity to go into a deep state of relaxation that will induce that in the child.
Right, so there's no sense getting the child there only to give the baby back to the mother
who's all wound
not
up
in that state,
exactly,
because it will throw them right out of balance. Okay,
so
that makes sense.
Yeah, and routinely when I work with a baby who's colicky, for example, I work with the mother, and the baby might be in the car seat or with dad or with some other caregiver in the room, and as I'm working with the mother, the baby calms right down without ever having worked with the baby. It's because it really is a transpersonal field that the mother and the baby occupy.
It's such a profound connection we can't imagine. And that's so great for moms, especially to hear at home, because being a mother myself, we are giving and doing and not getting necessarily all the nourishment we need, sleep and otherwise, that as we take care of ourselves, others do benefit. It's not a selfish thing.
Not at all.
It's a very giving thing.
Not at all.
As we take care of ourselves, that will energetically permeate the environment and the people, our children around us.
I often give the example that when you're in a plane and you're about to take off, the little spiel that they do on the runway, they say that in the event of a decompression, these air supplies will drop down, and if you're traveling with a child, make sure that you put yours on first. Right?
Beautiful.
So
exactly.
That's a really important thing for new parents, especially mothers, to recognize that it is a kind of service to the child to take care of yourself. And it's not just a kind of spa-like experience. It's actually being taught at a visceral level, a kind of somatic level, to induce a state that facilitates the development of the mother-child bond. Yeah.
Well, I mean, what an investment into a long-term wisdom of personal care,
Right.
and which is essential to our health and longevity, our
Yes.
mental health, our physical health,
Yeah.
emotional health. And so it's wonderful. So almost when a mother comes in with a baby who may have had a traumatic birth incident, the gift in it is that they get to learn so much more than they maybe would have otherwise, not searching out necessarily searching out some help.
That's right. And a lot of times too, I find myself in this role of kind of mediating between the infant and the mother, because a mother typically has a birth plan, an intention around a birth, and idealizing it, saying it's going to look like this, it's going to feel like this, it's going to happen like this, and it doesn't.
Yeah.
Oftentimes there's something that comes up
Sure.
that is a shock.
Oh yeah.
And there's a big grief around that loss of the ideal birth. So a lot of the practice of working with mother as well is to say, this is a healing for you as well.
Yes.
And that if you can let go of this unresolved grief around the birth not happening the way you wanted it to, then the child, the infant, gets a chance to relax. Because mom says everything's okay.
Because you're not hanging on to the past anymore. So as we let go, we make space for now. That is beautiful. That is beautiful. And I think that's in so many cases, because there's our plan, there's my plan, your plan, and then the divine plan.
Exactly.
Right? And they say, if you want to make God laugh, tell her your plans. Well, this is so funny. So this is great. This is such an informative program that we're offering here. And what we could do is I could get onto the table here on the second half of the show.
Okay.
We could describe some things. If you're interested in that, stay tuned. We'll be right back with you after the break.